with brain radiosurgery. First in America with body radiosurgery for cancers of the brain, body, and prostate. All custom tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're live, and we're taking your calls. We'll talk about a man, 73 years old, married with 2 children, who had tenderness in his shin bone, in his left tibia. He saw many doctors. He saw his primary, he saw orthopedics, he saw his cardiologist, he saw multiple, and he said, I've got this pain here, and no one did anything. He went to them in 2013. No one did anything. A year passed, and finally he developed a mass there, so it started growing out of the shin bone, and only then did he get evaluation, MRI showing a mass, a destructive mass, and by then the cancer had already traveled to the lungs. This is a sarcoma. Sarcomas are cancers of the connective tissue, so the bones, the muscles. Any part of the body can have cancer, but sarcomas are most commonly starting in the bones and the muscles and connective tissue. So he had surgery. They went in and operated. They cut out some of the cancer in the leg. They put in a little plate. Now remember, he already had metastasis to the lung, and they did a bone scan, which looks like there's 2 rib metastases. So the cancer's in the bloodstream. Once it gets in the bloodstream, it can travel to any site in the body pretty much. By May, there was a question of a lymph node metastasis by PET scan. He started chemotherapy in May. He had 2 cycles, and the cancer grew. Actually, they told him it doubled. Metastasis in the lung went from about 5 millimeters to 10 millimeters. Well, that's true. In diameter, it doubled. But if you think about how much cancer there is, like if you're buying peanut butter, you don't buy peanut butter by how tall the jar is. There's 3 dimensions to a jar. There's height, width, girth. So if you figure out the volume of the cancer, in just 2 months, the cancer grew by 500%. Wow. Did the chemo work? No, and chemo very commonly does not work for sarcomas. So he started another chemo a month ago. He came to me this week. I looked at him. I did the calculations. That's how we figured out the cancer grew 500% in 8 weeks. We talked about other options available to him. He's trying another chemo, which hopefully it will work, but probably it won't work. We talked about treating the primary site because that was while having surgery. The surgery left plenty of cancer behind. There's cancer in the ribs, there's cancers in the lung. These are all sites that could be treated, most likely about 90% success, with stereotactic body radiosurgery, a non-invasive treatment that we pioneered. We brought to this country about 20 years ago. We treated about 20,000 patients. So if your cancer treatment isn't working, or if it isn't tolerated, or it has a very low chance of working, like in this man, unfortunately, you might want to give us a call and make an appointment and see what your options are. And another patient, similarly, with thyroid cancer, a very nice woman with great family from Long Island. She had a thyroid mass detected by her gynecologist. She had surgery on that thyroid. The cancer was growing up against the trachea, the windpipe. She then had radioactive iodine. She had standard radiation. Big cancer hospital gave her standard radiation. Nothing worked. No success. By now the cancer is about the size, it's actually bigger than a fist. It's 12.5 centimeters. So a man's fist, my fist is about 8 or 9 centimeters. This is 12.5 centimeters growing through the trachea. She has what's called a tracheostomy, a little hole in her trach so she can breathe through that hole. She can't eat because the cancer is growing through the esophagus. We staged her up. She had never been staged recently. We staged her up and found the cancer was only in this one area, but it's in this area with a vengeance. So they looked around for options. They went to all the big hospitals and famous places. They heard about us. We even told them there's other options. They can go for embolization. The embolization doctors felt that it was too big, too dangerous. They couldn't get a blood vessel to embolize. We're treating her with radiosurgery. We gave her first treatment on Thursday. She had the treatment and called the family yesterday, and they say that she's stable or better. So we hope certainly that she's better and breathing better and has a good recovery. She's going to have 5 treatments. Usually our patients have 5 treatments. Usually each treatment is 15 minutes. Outpatient, you come in, get a treatment. We aim at the cancer. You get up and go to lunch or go shopping or go where you want to go, but no hospital. Our goal is outpatient treatment. There's less chance of infection, superinfection. We know the costs are a lot less. If you look in this month's ARP, one of the recommendations to save money was to go to a freestanding radiology facility, not a hospital, because you can save a lot of money, and we know that's true, but that's not really the reason. We think you should go because you get better treatment, you get personal treatment. It's a private cancer center that's not subsidized by the chemo industry. It's between the doctor and the patient. The patient is the boss. That's who we serve. So for this woman with a very big tumor, we believe we have a good chance in shrinking it down. We can never promise anything, but a good chance, and we hope for her success. We work for her success. We pray for her success. And similarly, we saw a woman this week with bilateral breast cancer. So she's a 67-year-old black woman, and I mention again because the black community has twice the death rate of white community for breast cancer. This woman had bilateral breast cancer. So on the left side and right side, she had cancer. On the right side, her cancer was 0.5 centimeter with good margins, so it's about 1/4 of an inch. On the opposite side, the left side, the cancer was about 2/3 of an inch, invasive lobular cancer. There were no lymph nodes involved on either side. She has an excellent chance of being cancer-free with lumpectomy, which is the lump of cancer removed, and radiation, keeping her breast intact. She wants to keep her breast, and we advocate that. There's great data, and actually some data showing better results being cancer-free by lumpectomy and radiation versus even mastectomy. So I know there's some women out there who get mastectomies because they think that that's going to give them better results. The answer is not true. So if you have a lump in the breast, you want to look at all the options and talk turkey about what is the best chance for you. We're happy to meet with you, go over the data. There's many women out there who have lumps in the breast who are even afraid to have the lump biopsied or removed. I saw a woman this week. She was referred to me. I saw her and treated her in 2008 for a cancer of the foot. She saw many, many doctors who wanted to amputate her foot. In 2008, we gave her the options of amputation. The patient can always do what they want. A patient is in charge of their body. But we also talked about non-invasive treatment, radiosurgery to her foot. She was treated in 2008. And guess who came walking into our office this week with 2 feet? This woman. And now she has a lump in the breast, in the right breast. It's about 5 centimeters, so about 2 inches, just under the nipple on the right side. It's distorted the nipple and distorted the breast. She saw another cancer doctor. She refused a mammogram. She refused a biopsy. She was afraid of pain. I saw her. I examined her. It was great to see her because, number one, she's cancer-free in the foot. 6 years later, she's walking with her own foot. No cane, no prosthesis. Radiosurgery worked on her foot when others wanted to do amputation, which points out the possible benefits of a second opinion. And I always tell people, you may want to get a second opinion. Think how it changed her life. And even this week, the other doctor was going to give her cancer pills, which doesn't really have a chance of curing her, without knowing if it's breast cancer or not. We arranged, I talked to her, I spent a lot of time with her, and her daughter came in. We talked about how we could do a biopsy. We could just numb up the skin, put a tiny little needle in, suck out some cells, and get the answer. And isn't it better for the patient to know exactly what the patient has, for the daughter to know if there's breast cancer in the family, and to give the best possible treatment? Well, I believe so. So for this woman, thank God, we had a relationship over many years. We saved her foot so far, 6 years and counting, and we hope to do the same for the breast. So we'll report back to you on what her biopsy shows. We'll be back. She just had it done late Friday. We'll be back early next week. We'll probably talk about it in next week's show. So, as they say in the movie industry, stay tuned. And we had a woman come in with a liposarcoma. So a lot of sarcomas today. Liposarcoma of the leg. She had had surgery. They removed a very big tumor. And then radiation. Now, when they did the surgery, the margins, the area around the cancer, was only a 0.5 millimeter, about a 50th of an inch. So very tight margins. And unfortunately, within a short period of time, she developed pain in the hip. The cancer started out in the thigh. She had multiple studies done that shows a lesion in the hip. This is all over the last year. First, they waited. They didn't evaluate her. Then they did a biopsy, which is negative. Not all biopsies are correct or positive. There's about a 10% error rate where they say it's negative, but it actually is positive. And then they made her wait another 4 months. Finally, she heard about us. She came in. She now has another lesion. So she had 2 lesions in the bone on the hip on the same side, all within about 3 centimeters or about 1.5 inches from the initial surgery. Now there's another lesion. So we sent her for a biopsy, and we talked about radiosurgery for sarcoma. We've talked about our success rate, our failure rate. We do have a failure rate. And the goal here is to try to hit the cancer, to relieve her pain, relieve her suffering. She's walking with a cane because she's having so much pain in the hip. Trying to get rid of that pain, get rid of the cancer. There's no other action anywhere else in the body. This is all a local spread of the cancer, local from the cancer just to the adjacent bone. And we hope to be able to hit the cancer and sterilize it and get her walking and hopefully make her free of cancer. This is Dr. Lederman from Radiosurgery New York. We're at 212 choices if you want to call us during the work week about the booklet, or if you have medical questions, call us anytime. We're live in the WOR studio. This is our 4th program of the weekend. We have 5 unique programs every week. One is on WABC from 5 to 6 a.m. on Saturday morning. And then WOR Sunday, we have a program at 1:30 to 2:30 a.m., from 3 to 4 a.m., from 6 to 7 a.m. That's this program, and you're welcome to call us if you want to check and see if we're not live. And then tonight at 9 to 10 p.m. on WOR. Now listen for a moment to our sponsor. We'll be right back to take your questions and hear new news.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no